5 signs that can unfortunately be deadly for diabetics. In this week's video, we're going to talk about diabetic ketoacidosis, a condition that can unfortunately lead to death. This is very important content, so take advantage, watch it to the end, as I'm sure you will leave here learning something new. Firstly, we're going to talk about what diabetic ketoacidosis is. It is a complication that occurs in diabetics due to insufficient insulin production. So this can primarily occur in type 1 diabetes patients or LADA type diabetics who are older diabetics and need to use insulin. But don't be fooled. Type 2 diabetics can also get diabetic ketoacidosis, which can lead to death. So it is very important that you watch this video to the end to understand the symptoms, understand the signs, and if necessary, seek emergency medical assistance. So we're going to discuss diabetic ketoacidosis and the signs and symptoms so you can understand and absorb them. Of course, if it's just one symptom, you don't need to rush to the emergency room immediately, but you'll learn to correlate your current situation with a possible onset of diabetic ketoacidosis. So basically, diabetic ketoacidosis is a lack of insulin production. Type 1 diabetics, as most of you probably already know, don't produce insulin and need to inject it daily. In some cases, people stop injecting insulin and end up being diagnosed with diabetic ketoacidosis because they stopped injecting insulin. So blood sugar levels increase, and without insulin to absorb the excess glucose in the bloodstream and turn it into an energy source for cells, the body ends up using fat as a source of energy. So it ends up producing an excess of ketones, and these excess ketones can poison the body, causing death. Therefore, it's crucial that you pay attention to the signs and symptoms so you can seek a doctor, an emergency room, or urgent care if you're entering diabetic ketoacidosis. Starting with sign number 1, which is a sign we often observe in patients with high glucose, that is excessive thirst. So when someone has extreme excessive thirst, it could indicate that their glucose is too high. Then, to compensate for this excess glucose, it is eliminated by the body. Through the kidneys, it induces this craving, this excessive thirst, leading the person to drink 3, 4, 5, 6 liters of water and still feel thirsty due to the defense mechanism of the body needing to eliminate the high glucose in the bloodstream through urine. So another sign and symptom is frequently going to the bathroom. From the moment that you drink a lot of water and your bloodstream has high glucose, you have to eliminate this excessive water you've ingested, and along with the water go the minerals and the excess glucose as well. However, don't assume the problem will be solved because the glucose molecule is larger. The more glucose your kidneys have to filter, the greater the chances of kidney damage. Kidney injuries can result in a chronic complication which takes longer to develop, known as diabetic nephropathy. This can cause chronic kidney failure and can lead the diabetic to a situation requiring hemodialysis treatment. So they need to go to the hospital to filter the blood to maintain the body's balance. Don't be mistaken, diabetic ketoacidosis is an acute complication, meaning it needs to be treated immediately. Other complications like heart issues, cardiovascular problems, kidney issues, vision issues, and problems also in the extremities of the body, like diabetic neuropathy, appear over time. Ketoacidosis, however, can lead to death quickly, so be alert to this. The second sign is unexplained weight loss. We use it as a base to lose 10% of weight in a month. That is, if you are with 90 kilos today and loses 9 kilos in a month and did nothing to make it happen, he did not follow a better fit diet, did not practice physical activity, ended up eating. Usually you didn't practice so much physical activity, and even then you lost a lot of weight. It's a sign that you're out of balance in the insulin issue versus the issue of glucose. That is why it is very important that the type 1, type 2, type LADA diabetic patient always take the blood glucose measurement at the fingertip to check how the levels are. Or if you notice that you are thirsty excessively, that you're going to the bathroom several times a day, and that you are losing weight in a significant way without changing your diet, without practicing physical activity, it can be a sign of imbalance in your body, and that it can become diabetic ketoacidosis. Another sign we observe is excessive hunger. So it ends up being a little contradictory since the person is losing weight but is still very hungry. What is the connection that ends up happening between these two signs and symptoms? The body, for not having glucose inside the cell due to a lack of insulin, ends up sending signals to consume more and more food. And from the moment that the person, the diabetic, continues to eat, does not have controlled glucose, is lacking insulin, glucose continues rising, so it can reach that HI value, which is a value above 600, where the glucose meter can no longer read. And this is very serious. It can cause the appearance of diabetic ketoacidosis, which can lead to death. So it is important to be aware of these signs. And symptom number 4 is excessive fatigue. From the moment you lack energy because the glucose isn't entering into your cell, you tend to get increasingly tired, more disheartened, despite sleeping well, for example. So from the moment you don't transport the glucose that's in your bloodstream into your cell, that's how I like to talk to simplify your understanding, because if I explain it technically, you won't get it. So basically, glucose circulates in our bloodstream after we eat, and from there, when it's in our bloodstream, it needs to go into the cell. And it's the insulin that will take this glucose and transport it into the cell. It's going to be used as an energy source. And if you lack insulin to perform this motion, you will have high glucose levels in your bloodstream. You will be excessively tired due to lack of energy, and you will be able to end up developing diabetic ketoacidosis as well. So everything's sort of directly connected. If you drink a lot of water, go to the bathroom frequently, are losing weight, but don't stop eating and are always getting tired despite having a balanced diet, that could be a sign that you have insulin production problems. In type 2 diabetics, we see a lot in patients who have been diagnosed for several years, and from the moment the pancreas starts losing its ability to produce insulin, they can also enter into an episode of diabetic ketoacidosis. So type 2 diabetic patients who have difficulty controlling glucose also use insulin, and if they decide to stop using insulin, they can end up in an episode of diabetic ketoacidosis too, which can be fatal. It's an acute, very serious complication that requires great caution and care in addition to attention. And the 5th sign is nausea and vomiting. The body starts to produce acetones due to the lack of insulin usage to uptake glucose into the bloodstream, and these produced ketones can lead to the onset of nausea, which is more like stomachache, and also vomiting, to eliminate the excess of ketone produced, because the body starts to use the layers of fat or fatty tissue as an energy source. So if you are experiencing these symptoms and notice a correlation between them, it is crucial that you check your glucose levels. If your glucose is high, you must seek immediate medical attention, as this could be a sign of ketoacidosis, which can be fatal. It is very important that you stay alert to these circumstances in order to take care of yourself to achieve a larger and better goal in terms of managing your treatment. And from there, regularly visit the doctor, take glucose measurements, maintain a balanced diet to avoid high glucose levels, take part in physical activity to correctly use your glucose as an energy source and thus maintain a good blood glucose level. Controlled, reduce your glycated hemoglobin, gain more health, better quality of life, and live free from this acute complication. And most importantly, live free from the emergence of complications medium and long term, as I have already mentioned here, that can lead to blindness, loss of bowel function, intestinal, can lead to amputation, to heart problems, and so on. The diagnosis of diabetes is no joke. It requires care, it requires attention, but it can be managed in the best possible way with knowledge by putting the tips into practice. That's why it's important that you watch the videos until the end, thus gain knowledge, put it into practice, gain a better quality of life, good blood glucose, good glycation, and improve your treatment more positively each time, okay? And this was this week's video where we talked about an acute complication, which is diabetic ketoacidosis, and that can lead to the death of the diabetic, and that unfortunately ends up causing deaths every year. So take care of yourself, be aware of the signs, the symptoms, and from there continue to improve your treatment, okay? If you are watching it so far, it's a sign that you like the content. And if you like the content, be sure to subscribe to the channel, to leave your thumbs up, to activate notifications. And the main thing, don't forget to share this video with your friend who may have doubts about diabetic ketoacidosis, which is a topic that is little discussed and the diabetics need to know more about it, okay? And after all, it doesn't cost you anything to share it on Facebook, on Instagram, on WhatsApp, because this way YouTube starts to understand that it is a content of relevance and spreads it to more and more people, okay? Now, I want you to stop whatever you're doing and give a score from 0 to 10. How do you rate this video? Because if it's a 10, I'll keep bringing you quality content so that you can keep learning and improving your treatment, okay? Over here, I'm going to provide another great piece of content. So don't forget to keep watching the channel's videos to keep progressing with your treatment, gaining more health, more self-confidence, better quality of life, and living free from the risk of any kind of complication, all right? So we're going to wrap up here. Take care, God bless, and see you later.